Good morning. My name is Tija Hunter, and I am a dental assistant. I've been a dental assistant for 35 years. Today, I would like to talk to you about chart notes, documentation, document. And I know that we talk about that, you can't write enough chart notes, and the truth of the matter is you truly can't. Lawyers say one of the worst things that we do in dentistry is we don't write enough chart notes. And what you may think is silly, truly isn't silly. You need to write down everything because later on that may become important to something that's happening down the road. So you can't document enough. For instance, nitrous oxide. Did you know that you have to report that the patient regained normalcy? Of course, you have to ask the patient, and most of us do, but are you documenting that the patient regained normalcy? If you're not, you really should be. Also, on every procedure, lawyers say you should write no complications occurred, and that would be for a sealant, for restoration, for a crown, whatever you're doing, no complications occurred. That's just kind of closing the book on that procedure and that you're documenting that no complications occurred. One of the worst kind of mistakes we're making is we are using abbreviations. We're writing almost an entire chart note on abbreviations alone. Well, that's not bad, but most of the time the abbreviations are your abbreviations that you or your office created. What you have to keep in mind is anybody needs to be able to go in there and read those chart notes and know what that abbreviation is for. If it's something that you and your office have come together and made up, it's really not good. You need to write it out. Most of us have a template in our software, Dentrix, EagleSoft, Carestream. There's a template. So go in and have your doctor set the template up for what it needs to say legally, and then you just kind of fill in the blank where you, for instance, again, nitrous oxide. The length of administration and total minutes they were on it. The percentage used. You need to document all of that. And I see that we're not doing that. That's all very legal. One thing is edit that out. One thing is that this is a legal document. If something happens and the doctor is brought up before the board, this is a legal document. This is evidence in a court of law. And when you realize that you're writing and documenting evidence, it becomes a little bit more serious. So please use that to your advantage. Got any questions?